Hey everybody, it's Rishi, and in this video I'm going to show you a classic case of pulmonary mucormycosis. I put the DICOMs in pacsbin, so you can check the link in the description below if you want to follow along with me. Alright, so this is a patient who is in their 30s and had AML. They were treated with stem cell transplant, but they relapsed and they were coming back into the hospital. And this was a chest x-ray about a month prior to their hospitalization. And to me it looks pretty clear, and that's how it was read. This is a follow-up chest x-ray about a month later near the beginning of the hospitalization, and you can see that there's a focal airspace opacity right here in the left mid-lung. The patient also has a new PIC in place. This is the follow-up chest x-ray only 5 days after the initial chest x-ray, and you could see that that airspace opacity has increased significantly in size, and there's a new area of consolidation in the right lower lobe. So this is the CT of the patient, and this was done on the same day as that last chest x-ray. And you can see that there's a left lower lobe consolidation here. It's sort of rounded in shape, and it's unusual in attenuation in that the consolidation is around the outside of the lesion and the ground glass opacity is in the middle of the lesion. And this is something called the reverse halo sign. And it's not to be confused with the CT halo sign, which is a different sign. The CT halo sign is where you have a solid nodule or mass, and around it you have ground glass opacity. So this is just the opposite of that. You have the consolidation around the outside and the ground glass opacity in the middle. So this is the reverse halo sign. Some people also call this an atoll sign, and they use the term atoll and reverse halo sign interchangeably. I tend to think of them separately in my mind because I link the term atoll with organizing pneumonia and reverse halo with pulmonary infarct and pulmonary mucormycosis. And the difference is that when you have organizing pneumonia, usually the peripheral consolidation is not this thick. Okay, when you see a peripheral consolidation that's this thick, I'm usually thinking that the patient is going to have an impending pulmonary infarct. Now, this patient, because of their history of hematologic malignancy and stem cell transplant, this was called suspicious for pulmonary mucor, and that's what it turned out to be. Pulmonary mucor is a pretty aggressive fungal infection, particularly when patients are neutropenic or have hematologic malignancy. And it can also be seen in patients who have uncontrolled diabetes and who are on corticosteroids for one reason or another. The reason why it's important for radiologists to recognize mucor is because pulmonary mucor has a very high morbidity and mortality. So if a radiologist can recognize the signs of a reverse halo sign on CT, then they can alert the clinician that this might be pulmonary mucor, and the patient can be put on the appropriate antibiotic therapy right away, which is usually amphotericin. The main thing in the differential for these patients is usually invasive pulmonary aspergillosis. And the reason why that distinction has to be made between aspergillosis and mucor is that most cases of aspergillosis can be treated with voriconazole, whereas mucor is usually not susceptible to voriconazole. Another important point about mucor is that if it's confined to one lobe, it can be successfully treated with surgery, and that can reduce mortality in these patients. Unfortunately, this patient had consolidation in the right lower lobe as well, and this was also an area of mucor infection. Okay, so the take-home points for this case are that the reverse halo sign, when coupled with the appropriate history of either hematologic malignancy, stem cell transplant, solid organ transplant, uncontrolled diabetes, or corticosteroid use, should make you think of pulmonary mucormycosis. Usually as radiologists, we don't like to name specific bugs, but in this case it's important to name mucor specifically because the patient needs to be initiated on the right antibiotic therapy right away. Alright, thanks. If you have any questions about this case, please leave them in the comments below.